So, welcome everybody, and hi. Today is a special but very much needed episode. We are on to day we're on to day 7 of the quarantine of myself, and I've been doing these kind of every single day. But I'm joined here today with Dr. Michael Head. He's an epidemiologist and senior research fellow in global health at the University of Southampton. He's based in clinical informatics research units and has a background in infectious diseases, epidemiology areas such as pneumonia, interests in neglected tropical diseases in West Africa, Ghana and Togo, and currently developing some data analytics to support the NHS. Now, we are not talking about little Maggie down the street who has watched some sort of conspiracy theory and thinks that she has now suddenly just become an immunologist, even though she used to sell Avon just last week. We have an expert, guys, and this is something that I wanted to, debunk some of the rumors, have some real conversation, and maybe help a lot of you guys feel better about your anxious thoughts. So I've compiled a lot of your little questions, and we are going to get right into it. So pleasure to meet you. How are you, Michael?
Not too bad at all, thank you. Thank you for inviting me onto your podcast.
That's perfect. So today we're just going to talk about the first question that's burning. How serious are we talking about this? I know that everybody's in lockdown right now. We're all getting kind of worried. We're all panic buying. We're all running out of toilet roll. But what do you actually think? Is this going to be with us for many, many months to come?
Oh, for sure. It's going to be with us for at least a few months yet. And that is the optimistic scenario, really. Okay. So UK predictions are that we'll possibly get to a peak of cases around late May or June. And then hopefully thereafter cases might start to decline. What we don't want to happen is a big second wave of cases, particularly as we go towards the winter. But I think for the next few weeks, we can expect to see what we've got now, a significant amount of lockdown and restriction of services and so on. But hopefully towards the end of the summer, we might have some brighter times ahead. But as ever, everything is so uncertain. So we shall see with that how we go.
Yeah, you're getting quite popular with all of this. I've seen you on different podcasts and things like that. So you're in quite high demand. So thank you for coming on. How exactly is it passed? I want to just, treat it as if I don't know anything and you're just suddenly telling me and any of the viewers are watching just how exactly is it passed? Because there's a lot of rumors about that. Like a lot of people saying that it can come through walls. It can, all these crazy things like that. So that people can kind of get educated on how exactly it's passed.
So it's a respiratory infectious disease. It's a little bit like flu in the sense that when you sneeze or cough, you expel some of the viruses on your breath and in your sneezes and so on. They don't remain in the air for very long, but they will land on surfaces, which you might then touch. And if you then touch a surface and put your hand to your mouth and touch it, that can potentially transmit the virus that way. So it's quite easy to spread around the community because you are sneezing and coughing and breathing it out to a certain extent if you're infected. Right. So the isolation and social distancing measures are so important because it reduces the amount of people that you contact and lessens the chances of you transmitting it if you are infected, the chances of you getting infected it from someone else.
Okay, so it is very, very, it is as serious as people are saying. Like, self-isolation is a necessity right now, for sure.
I mean, that is really so important. I can't really stress that enough. Even today we've had reports in the local papers of people still having barbecues on the beach and so on, which is just really, really bad practice. The best way to get this sort of pandemic reduced and cases reduced is to practice things like good hand hygiene, so washing your hands a lot, but also this social distancing. It's really important that people do comply with it. If people don't comply with it, it doesn't work. The pandemic carries on for a lot longer. And then essentially more people will die than is necessary.
Yeah.
Many of us are relatively young and fit and healthy, but we all have elderly relatives, for example, who will be vulnerable to this. Yeah. So we all have to do our bits to try to reduce the number of cases and the amount of time it's around.
And with the percentage of cases, a lot of people were saying, it's scaremongering. This is all just going to blow over in a few weeks. It's all, there's been some rumours that there's maybe been predicted that 250,000 to 500,000 people could, in the UK alone, could die of the virus. And a lot of people get scared of those numbers, because it's a lot of numbers.
Yeah, so the numbers come from modelers, and it's modelers' job to try and predict the future, which obviously in something like with a new virus, it's so difficult to work out. But we have some numbers that we can use to work out how best to try to counter the virus. Those numbers of 250,000 or more cases, that's the worst case scenario. So one of the things modelers have to do is work out what's the worst that could happen. And then you try and prepare for what's the worst that could happen, hoping and expecting that you won't really get anywhere near it. So I don't think in the UK we'll get that many deaths from it, but there certainly will be, you would anticipate thousands of deaths, which obviously is many thousands too many.
Yeah, I mean, any is too many, isn't it? It's there's a lot of different kind of things going around, like cures. Apparently there's a malaria drug that's speculated to be credible right now, that they are have you heard any more on that at all?
Yeah, so there's a few other drugs that might be, I think, probably a little bit helpful in terms of reducing how serious some of the cases can be. So there's various researchers who are looking at malaria drugs, they're looking at HIV drugs,
Yep.
and also drugs for other viruses like flu, to see if they might have some effectiveness against the coronavirus. We don't really know yet. There's a little bit of evidence that some of these drugs might help a bit, but I don't think we can really expect any of them to be the kind of blockbuster cure that the world is looking for right now.
Yeah, and do you think there ever will be something like that?
Well, there's lots and lots of research groups working on a vaccine, and that's what we really desperately need, is a really good vaccine, and then that could potentially halt the virus in its tracks if we do get a good one. The problem with that is we're starting pretty much right at the beginning, so we have laboratory studies before the human trials. Many vaccine candidates just don't make the grade.
Okay.
So I think we can expect a vaccine bare minimum 12 months time, and then we have to hope that that's a good one at that point.
Okay.
So it's not a really optimistic scenario in the short term, but I think in the longer term we will have a vaccine. But before then, we've still got many months of trying to counter the virus as it is at the moment.
Exactly. And there's a lot of people that are saying things like, for example, a lady commented saying that her son actually has just came back from uni, and she wanted to pick him up from the university and take him back to the family home, and where he would then stay. But he's probably and potentially been at risk. What should that family do? Should that son be in quarantine, self-isolation in his own house? And how would he do that effectively to, stop it from reaching the whole family? Or is that ultimately, if it reaches the family household, is it inevitable that it's going to reach everybody in that household?
It's not inevitable that everyone will be infected, but obviously if you're living in the same house, very close proximity to other people, there's a fair chance that you will get infected as well. I mean, if the son is currently fit and well, fine to go and pick him up and take him home. Just follow the latest public health guidance, which does change quite regularly. I struggle to keep up with it as well.
Yeah.
But if somebody does come down with symptoms, then isolate them in your household as best you can. Some people have separate rooms and so on that they could use for it, but not everyone does. So it's a case of doing what you can to reduce the risks, but in the knowledge that there probably will be some risks remaining.
Okay. And I've heard some rumours about the anti-inflammatory drugs such as, ibuprofen, paracetamol. I've heard that these can actually be quite damaging with regards to if you're taking these during having the virus.
Yeah, so I've got a great interest in that because I'm taking some anti-inflammatories at the moment. I've got a slightly dodgy hip, so I've got some fairly strong painkillers for that. So the latest knowledge is such that there may well be a link between use of things like ibuprofen,
right.
Slightly worsening the symptoms if you are infected. So if you are taking ibuprofen as recommended by your GP or something similar to ibuprofen, then do check with your GP if you do get symptoms. Try and get a phone consultation with them as soon as you can. If you are not normally taking ibuprofen and get the coronavirus or get the symptoms that match the coronavirus, then try and go for paracetamol as your first choice of painkiller. Right. But anything else with that, then do phone up your local doctor and just get them to give you their opinion as well.
Okay. And the other thing I was going to ask, you specialise in a lot of like crunching numbers and you deal with a lot of analytics. A lot of the numbers that are coming out right now, for example, in Italy, why is Italy such a place that is completely, the numbers have even overtaken China for the death toll? Why is that?
So Italy seems to be quite an interesting case study. I think the early cases in Italy were in some of the more vulnerable cases. So their mortality rate is therefore quite high. I mean, remember, we are sadly still at the early stages of the outbreak.
Mm-hmm.
It might feel like it's been forever, but it's really only been a couple of months.
Yeah.
So I think as we go through the rest of the year, the mortality rates in Italy will decline somewhat. And then we'll see other countries that have currently got a very low mortality rate, like Germany. I think their rates will increase as the virus spreads into their more vulnerable populations.
Okay.
I think Italy was caught slightly by surprise, and there were a fair few vulnerable populations infected before the outbreak response could really kick in. So I think their mortality rate is slightly artificially inflated, but the reason is that it was vulnerable populations who got infected first up.
Right. And do you think that the other countries we are going to probably follow in that footstep? Maybe we are 2 or 3 weeks behind in the UK, or is the US potentially going to be even worse, or is that just too hard to predict at this moment?
It's quite hard to predict. I think the UK does appear to be following kind of the Italy trends to a certain extent. So we shall see how that pans out over the next few weeks. It wouldn't surprise me to see, at least in terms of case numbers, something similar to Italy. America is just quite an interesting country all round for this sort of thing. They've got a political leadership that can probably at best be described as volatile and not terribly helpful.
Okay.
Their health system, you have to pay for everything in the health system and not always covered by insurance. So there's been lots of reports of people having to pay to be tested, which obviously encourages people to forward for testing. I think they have now made the tests free, but if you are positive and then have to go to hospital, I don't know if that care would be free as well. So there's lots of complicating factors around the states that isn't always in other countries. But certainly their case numbers are going up dramatically. They will have a lot of cases that have not yet been diagnosed and therefore recorded as cases. So I think it's going to get probably quite a lot worse for the US before it gets better.
But they do have a lot of people, they look at numbers, but they see that America does have a larger population. I mean, Italy alone has 80 million people, I'm sure. I always thought, I never actually realized Italy had so many people. So there's some countries that are like the Netherlands, which is like 17, 18 million. And it's lower there. Belgium, actually, I saw quite a high increase the other day. So you're seeing all these, like Switzerland as well, they're actually shutting down these ski resorts in places that are looking quite dangerous. So what we're all worried about is just like, is it worse when you're actually in a place where more people have it? Is because there's been some cases where in Italy the younger people are even dying from it. Is it because they're in a petri dish or something like that? You're in a more concentrated area. Does that mean that it becomes more aggressive?
Probably not more aggressive per se, although you may get what's called a higher viral load. That's basically the amount of virus that you maybe sort of cough and sneeze out. So healthcare are particularly vulnerable to this because they might be exposed to a high viral load. So if they've got a load of cases of coronavirus in the ward, if they're not fully protected against it by wearing masks and such like, you may well be exposed to larger numbers of viruses, which might result in a more severe infection. So perhaps if the younger people in Italy were exposed to people who were expelling a lot of virus, they might themselves have got a more severe infection because of it. So that's one of the different sort of dynamics that can influence how ill you are with it. There's other factors like whether you are elderly or have existing health conditions and so on. So there's lots of different factors in play that will affect how serious your illness can be.
And what are some of these health conditions that are underlying that are most serious? What are the kind of, who are the most vulnerable in our society? I know people that are over 80, but in general, what are those kind of things that we should watch out for and really to protect our loved ones?
So those who are already seriously ill, so if you have, for example, something like cancer or if you have cystic fibrosis, they're significant risk factors for having a far more severe illness from coronavirus and if you are fit and well. And then there's other, as we call them, comorbidities. So things like diabetes and hypertension, that's high blood pressure.
Yep.
They also seem to have quite an impact upon how severely ill you are. So in the UK, we did have someone die who was 18 years old, and that's, I think, our youngest death in the UK.
Wow.
We don't know about them other than they did have severe underlying health conditions. So they were young, but they were a vulnerable population.
Right.
So it can and does affect all ages, sometimes very seriously.
Okay, so we're not all safe. There's these people that are out drinking in pubs thinking they're invincible. We're not all invincible?
No, we're certainly not all invincible. So again, people should not be having barbecues on the beach or going to the pubs. And even if, again, to kind of repeat the point from earlier, if you are fit and well, you might well get infected, but get mild symptoms. And actually, on a slightly more positive note, most people do get mild symptoms. About 80% of cases are pretty mild, where you feel about as groggy as you do when you get a cold, for example. But obviously, the key focus has to be on the 20% who do get more ill, and some of those will be serious and some of those do die. So even if you are getting a mild symptoms, you may well be able to transmit that to someone who won't get mild symptoms but will be much more serious. So again, it is up to everyone to practice good social distancing, good hand hygiene, and not to go to the pub, basically.
Okay. And that's hard in the UK and in Ireland especially. I've seen some kind of things floating around about that. Okay, so we have the children. So children, there's people that are worried because maybe they're going through pregnancy right now, or they're about to have a child, or they do have a very young child, maybe from the age of 0 to 3 years old. Is that a kind of vulnerable age as well?
Well, pregnant ladies have been put under the kind of list of vulnerable population, and that's basically a precautionary thing. The little evidence we do have so far is that there don't appear to be obvious amounts of complications in pregnancy if you get infected with the coronavirus. So certainly if you are pregnant, you should be quite cautious about these things, but there's not a huge amount of evidence to say that there will be any adverse events regarding your pregnancy or regarding your baby. With regards to children themselves, again, they are mostly getting relatively mild symptoms. Again, not all. Some children have been hospitalised, but on the whole, most children have a very low level of illness. Okay. So that's good from their point of view. So they can still transmit the infection, so they shouldn't be mingling with elderly relatives at the moment, for example.
Yeah, and so a lot with that being said, a lot of people say that there's all these people say that this conspiracy theory and all these other weird, wacky things are going around, which is obviously predictable when something like this happens. Where did it come from? It's true that it did come from Wuhan? Is all the kind of data there? I also saw something recently that there had been reports, it's possibly all false as well, that Italy may have had it 2 months ago, I read, or round about the November, December time. Would that be true?
So the first cases that we know of were probably in early December. So the first case that got reported was the very end of December. We think there probably were cases in Wuhan at the start of December. Okay. There's been lots of us looking at the sort of the genetic material of the virus and trying to look at the early cases. So there's pretty good evidence to show that the virus came from bats in China, in the Wuhan area. Bats are a really good reservoir for viruses. They seem to be able to host many viruses without showing symptoms.
Right.
And there's strong links again to the food market that's been in the news a lot over the last few months. These food markets look to be quite astonishing places where they have so many different animals on the menu, with kind of sort of monkeys and bats and pangolins, other animals like that. And if you put all of those animals basically in a food manufacturing place in the sort of, one large sort of warehouse, if you like,
yep,
there's a lot of opportunities for viruses to jump between animals. People handling the animals, slaughtering the animals, are getting covered in blood and so on. So again, there's potential to transfer the viruses that way.
Okay.
Every so often, every sort of few years or so, we do see something like this happening. We saw it with SARS, for example, in the early 2000s. That was also a coronavirus like this one. Yep. Different type of coronavirus than this one, but the same type of virus on the whole. So I think really going forward, we can't be eating bats because they just host so many viruses. It'll be interesting to see how the Chinese respond with regards to these big food markets that they have.
Yeah.
But for sure, we've got good genetic evidence to show that this particular coronavirus almost certainly came from bats, probably via another animal before it hit humans.
Okay.
And actually, the pangolin is the latest good theory. And also, pangolins are one of the animals in these food markets that get eaten as well. So there's decent evidence there.
Yeah. Well, Batman was one of my favourite superheroes there. I'm starting to rethink that, honestly.
Maybe that was his success. Maybe he had such a good viral load that everyone just kind of fell apart in front of him.
Yeah, potentially. I mean, are you a fan of Batman?
Well, it was, but maybe not now. Maybe I'm going to rethink that, perhaps.
Yeah, I heard that there was a person that someone said that, and this is a quite dark comedy, but there was a guy that said the person who actually ate that bat is going to have the largest human to death kill ratio in the planet. Would it have just came from one person, or do you think it was a collection or collective?
Well, there will at some point have been kind of the index case, the case zero, as we tend to call it. There will at some point have been a kind of a first person infected. Whether that person then immediately went on to infect others, or whether the infected bat in turn infected a few people at the same time, I don't quite know. Actually, I don't know if we know that at all yet.
Okay.
But for sure, there will be a kind of a start of that chain of transmission, which obviously has spiraled out of control.
Okay. The other question I was going to ask is about our leadership. This is as someone who is an expert in this. Do you feel like our government has handled this effectively, or do you feel like they've been kind of lacking in some areas with regards to Boris Johnson and the government there?
Well, I mean, a bit of both, I would say, in terms of handling it well and being a bit lapse in other areas. I mean, so I don't particularly like Boris Johnson. I did not vote for him. I don't quite understand why he's Prime Minister, but he is. One of the things I think he has done well is often in his press conferences, he's had two scientists either side of him, and he's referred to them often throughout the press conferences. Okay. So you've had quite sensible comments coming through because these are senior expert scientists who are very good at what they do.
Yep.
So I think there he's actually done quite well. When he starts to speak about the coronavirus, understandably he knows nothing about it, and nor should he in a way. But you can almost see him start to panic a little bit whenever he has to kind of refer to.
I see honesty there when it comes to it. He doesn't try and hide that. I like that about him. I like how you dislike, but you also look for good in people. I think that's absolutely necessary for every individual, that you see what's going on, but you actually take away the kind of, no matter what side or no matter who you don't like, this is the leadership that you have, and you have to respect that this isn't all about political views and stuff like that, that it's actually people that are just wanting the better good for everybody and to minimise fatalities. That's and by getting the experts on either side, Patrick Vallance, what's the name of the other guy? Because I quite like him as a speaker. He's a really good, he's very good.
Yeah, so that's Professor Chris Whitty, who is the Chief Medical Officer. And he is absolutely brilliant. He's actually the perfect person to have in charge at this point in time because his background in emerging and infectious diseases, and he really knows his stuff. So the fact that he's leading the UK response is genuinely good for us.
Okay, so with the kind of herd immunity, there was a lot of controversy there. People were saying, the people saying, why are we not shutting down, and why is every other country shutting down quickly? What was all that about?
So the herd immunity, I actually thought was actually a little bit poorly explained. So the idea is that once you're infected, you will have some immune response that prevents you from getting affected again. Usually that's what we see with a vaccination, for example. The vaccine generates your immune response, and then you are unlikely to be infected by measles or whatever the vaccine happens to be. In this case, we're looking at people who actually have been infected. Usually, again, to use flu as an example, you do have some immune response to that strain of flu once you've been infected by it, or when you've had the vaccine against it.
Okay.
So the theory is that when a certain number of people are infected, they can't get infected again, so there's fewer opportunities for new people to spread the virus to. Right. That's the idea behind it. We don't know if that's true yet. There's some evidence to suggest that indeed you do have some level of immune response to it from this coronavirus, but we don't know that as yet, again, because it's such a new virus. We're basically kind of learning as we go along. In terms of what other countries are doing. So all countries are learning from others, particularly those that have had a lot of infections, like China and now like Italy.
Okay.
So we're trying to learn as much as we can from them. It doesn't mean we should be doing the same things as them, because they do have a different population at the different stages of the outbreak. They have different behaviours within their population. That's so important. The fact that here we'll have people, again, having their barbecues. Whenever you're kind of thinking about policies to intervene in this outbreak, you need to think that some people are not going to comply with those policies. So there's the behavioural science behind it as well. There's so many different factors to consider, one of which is learning from what other countries are doing and where they went right and wrong. But each country does need to develop its own guidance and own policies that are suitable within the local context, if you see what I mean.
Yeah, and I seen in Iran there was a lot of people not going by the rules there as well, because they had a kind of the New Year there. Was it a Persian New Year or something like that? And there was people in the gathering in masses still there, and that's a country which looks like it's getting affected quite a lot. Do you think that this is going to be a reoccurring thing maybe for 2 years? I think, how long did the H1N1 virus last?
So H1N1, as in swine flu, which was the pandemic in 2009. So flu is so I've used flu as an example a couple of times. Where it's different to the coronavirus is it mutates a lot more. So each year you get a new flu strain coming to the population. Hence why we need to develop a new flu vaccine every year. Hence why it's not the best vaccine, because it's kind of been assembled quite quickly. With regard to coronavirus, there's one theory that it may be seasonal, a bit like flu, so it may die down over the summer. Let's hope that's the case. I'm not convinced it will be.
Right.
We will see on that. It may be with us for a long time. It may stay with us, and we have to kind of just handle it and respond to it and develop a vaccine for it against it, so on.
Right.
But there's so many unknowns at this point in time as to what will happen, even in a few weeks' time, let alone next year or the year after.
Yep. And I'm sure that you're going to be getting, it's going to just keep getting more, you're going to get more and more on high demand. Little things like the milk, if you're getting milk delivered to your house, is that safe, or does that need to be sanitized as well? Is this a dangerous kind of way of contracting the virus? Those kind of things.
As in touching the bottle of milk or the carton of milk, you mean?
So yeah, if the milk has been delivered or something has been delivered, like a UPS or an Amazon order, it's coming in a box and shipped out. Should those be sanitized, and are you at risk of catching the virus through those?
I mean, the risks will be very, very small from that, although the risk will be there. There's nothing wrong with wiping down the bottle with a wet wipe or a cleaning wipe, and also just again make sure you wash your hands thoroughly several times a day anyway. So again, if you've picked up stuff that's just been delivered, that's a good time to then think, right, I'll wash my hands thoroughly. Hand hygiene is not a sexy topic at all. It's quite dull, the message wash your hands, but again, it is one of those really important messages that we do try to put forward as much as possible and that people should adhere to.
Yeah, I mean, apparently Donald Trump, he even before the virus, he washed his hands sometimes too much.
One of the few good things he's done, then, I would argue. But yeah, no, washing your hands is just seriously really, really important stuff.
Okay, I have a large American following on here, and what I would say is, do you have any sort of positives, anything positive to say coming out about America's response to this, or do you know much about that?
Well, they seem to be scaling up their testing, and if you're not doing tests, you don't know how many cases you've got or where the people are. So I think that they have now scaled up that testing far, far bigger than it was before, and I think hopefully that they have made the tests free as well, that you won't be charged for it. If so, then those are important developments that will help the US to get more of a handle on how big a problem it's got and how best to try and counter it.
Okay, and with the data, again, how do we know for sure that a lot of the cases that are coming through are actually not being misdiagnosed? Maybe people are just they're putting it into one without actually testing. There's some doctors, maybe they'll say things like, oh, that sounds like coronavirus over the phone. Maybe you have a temperature or fever. How do they actually truly diagnose that with regards to the figures and stats? Or Is that a potentially, that's quite hard? It's hard to predict the death toll because of that, or can they still separate regular flu from and regular pneumonia from the COVID-19?
So no, you're absolutely right. It is very difficult to distinguish the symptoms between COVID and flu, for example. So the figures that you see that get released every single day, they will be confirmed cases who've had a positive test.
Positive test.
Of the accuracy of the test, if you've had a positive test, then it's pretty accurate from that point of view.
Okay.
A lot of unconfirmed cases where we presume people have COVID-19 because they have the right symptoms and they've been told to stay at home and quarantine. They're not included on the official stats.
Right.
So they're not part of the stats.
So
Sorry?
The stats could be 10 times the amount that we have.
Oh, there will be any number of extra cases that haven't made the official stats. We know that. And for example, in the UK, we're mostly reserving our testing for particularly vulnerable people or those who have been hospitalised and so on, so that we can pick up the most serious cases. There will be a lot of people who have mild symptoms at home, who we are presuming have COVID-19, but they might have a cold, they might have the flu. As we go into the sort of spring, we know that flu and common colds reduce in number.
Yeah.
So beyond this point, if someone has symptoms that we think are COVID-19, it's more likely to be COVID-19, whereas before it could easily have been lots of other respiratory viruses as well. So that is one of the difficulties in trying to sort of disentangle the data and working out how many cases we've got.
Yeah. Is the NHS prepared, do you feel?
Well, the NHS is probably as prepared as it can be. The problem will be that we will have just too many cases, and at some point it's very likely that the NHS and many health systems around the world, as we've seen in Italy, will be overwhelmed by it. So we probably could have done a lot more. All countries, I think, could have done a lot more in between pandemics. Pandemic preparedness is what we call it. And the world generally, as we've seen, is very vulnerable to an outbreak like that, and has not got enough preparations in place. Some countries have responded better than others. The UK has a very good health service. So it will do, I mean, I'm sure a magnificent job with the resources it has going forward. But certainly the problem with the UK health service is the lack of capacity in the system. So as and when there's a large number of cases have come in, it will find it harder to respond and to give everyone the best possible care. And that's a problem we will face over the coming weeks.
Okay. And did you know, when did you yourself realize this is going to happen? We're going to be potentially in quarantine. We're going to shut shops, businesses and things like that. When did you actually feel that was going to happen? Did you know that from the beginning when it first was recorded in China? Or was that quite hard to predict also?
I think when we first got person-to-person spread in the UK, when an outbreak like this comes into a country and it's just imported cases from abroad, you then do diagnosis and what's called contact tracing, where basically you ask the case, who have you met, where have you been, let's find out who you spoke to. And you can then try and contain the virus that way. I think once that started to, once we started to go beyond that stage, when we started to see transmission between people in the UK, that was the point it looked like it could get quite big and quite serious here. Yeah. So that was a few weeks back now. So I think from that point on, I'm not surprised to see the way it's gone. Viruses just are very good and very clever at spreading.
Yeah.
So,
I mean, that's why when someone posts a viral content, it makes people realize just what viral is now. Like that kind of branches of the tree just spreading and reaching every part of the globe.
Okay, that's a really good point, and that's, I mean, this is it is quite literally how viruses work. If you've got a bit of social media that kind of spirals out of control and reaches sort of so many millions of people, that's how a virus works.
Yeah, and it's quite weird how it's almost like a comparison with an algorithm online to an algorithm for life. Like these viruses, there's a lot of similarities like that, and every year we have to deal with these kind of things. But this year is just it just seems like a more aggressive and dangerous one. Do you think it'll get even worse? Do you think it will mutate to something even further?
So viruses all mutate all the time anyway. And overwhelmingly, the mutations often just do nothing. Actually, when a virus gets into a population and stays there, what you usually see is that the virus becomes slightly less virulent, so slightly milder, basically means. So it's no good to a virus if it kills everyone stone dead the minute it gets in it, because then the virus can't be transmitted. It can't carry on.
Yeah.
So viruses will adapt and evolve, but often actually to be less harmful. So something like flu, it kills plenty of people as it is, it's serious, but the proportion of people that die from it is much less than 1% on the whole. So it's quite good at infecting people just enough so that they can get up and move about a bit, and infect other people and keep the chain of transmission going. So a virus doesn't want to be too lethal, because then it can't be successful and spread everywhere. So what we've seen here with the coronavirus is this perfect storm of being just lethal enough to and we're just transmissible enough to keep this chain going. As we go on, if it does hang around for a long period of time, I suspect it will be slightly more mild rather than more severe on the whole.
Okay, well that's good to hear. What are you doing? I'm obviously caring about yourself. You're someone who is doing all the data for the world. You're a hero, and thank you for that. But what are you doing for yourself during this quarantine? It can be quite bad on a person's mental health. A lot of us are, going crazy in their houses, lonely. Or what is your kind of strategy for that?
Well, thank you for describing me as a hero. I certainly wouldn't describe myself as that. I think I probably reserve that for some of the frontline healthcare workers, for example. But yeah, appreciated. In terms of what I'm doing, so you mentioned at the very start, I think that one of my countries that I do research in with is Togo, which is a small country in West Africa. They speak French there. So I'm actually using Duolingo to start learning French so that I can communicate better with them. And I've got my kids home now as well. So so we've been doing, for example, earlier on today, they were doing a few kind of posters to put up in the window so that whenever people walk past our house, they might see some nice cheery pictures of rainbows and so on.
Nice. Yeah.
As they look in. So I think a bit of time with the children and a bit of a sort of self-development for me with things like languages, just to try to pass the hours when I'm not working, basically.
Yeah, I might join you on that, because I did do French, but French is probably the one that I know most of. So it's probably the one, when you have that kind of language that you know most of, that's the one you're going to work on, isn't it? So I kind of wish sometimes that it wasn't French that I first learned most, because you realise just with the grammar and things that it's quite hard and challenging.
It is quite tricky. I learned Spanish as at school. I found that easier to learn then than with French now. So some of the intricacies about kind of the adjectives and the endings of the words and where you put the accents and so on, I'm finding quite tricky. I'm not good at languages. I'm a very typical English person by really only being good at English and nothing else. But I'm going to try and make the effort with my Togo colleagues to learn their language at least a little bit. Yeah.
Well, it looks like you're good at numbers for sure. That's been proven, right? I'm a quite analytical person, so I quite like talking to someone who has that kind of passion as well. And you have a background in science, and you live in Southampton. Is that true?
I actually live down in Dorset. I'm a little way from Southampton, but I'm based at the University of Southampton.
Dorset looks lovely, actually. Is that the Jurassic?
Dorset's a very nice place to be. Yeah, we're just on the Jurassic Coast. Yeah, so where we are, we're quite near a town centre. We're quite near the beach, and we're quite near the countryside. So we've got quite a nice area that we can't really explore right now at the minute. But otherwise, it's a nice part of the world to live in for sure. Yeah.
Yeah. Well, maybe in 3 months, I think that there's going to be a positive that will come out of it. I think in 3 months, do you think that we might actually, as summer is kind of approaching to its peak, we might actually be able to be outdoors and maybe almost celebrating that, and everybody will be kind of unified a little bit because of it?
Well, hopefully, and regardless of how the outbreak's going on, we have been told that it's likely at some point we will have, they call it switching on and off of interventions. So there might be that for a brief period, like a few weeks or whatever, normal services resume to some extent. We might be allowed to go outside or go to the pub again, things like that, before they then switch back on the interventions and say, right, more social distancing, please.
Yeah.
So we might see that anyway. And again, hopefully by the end of the summer, ideally, hopefully, not definitely, but hopefully cases will be a lot lower, so that we can go outside and enjoy ourselves a bit more.
Yeah.
And also there has been a bit of a community spirit building up, which is obviously nice to see, where people are starting to look out for their neighbours and things like that, and the various community Facebook groups and so on. So again, hope that community spirit can be kind of retained as we go through and beyond this pandemic.
Yeah. And last question: are you what kind of beer do you like? What's your beer of choice? Ales, or do you like a lager or a stout or something like that?
Yeah, so I'm basically a middle-aged, scruffy, beardy bloke, so I do like ales. If I go into a pub and find something I've never heard of before on tap, I'll generally just say, I'll have a pint of that, please, whatever it is. So that's generally my approach to drinking.
Yeah, so like you're trying to taste something you've never had each time. I like that. And in England, there's a lot of that. If anybody does come to England, they do ales very well there. So yeah, every time I go down, I always enjoy a nice ale and a nice English pub. You need to do that if you come to England. Go to a nice, with Scotland as well, but just have a nice beer garden in the summer. And I'm sure Dorset, I'd love to visit sometime. But thank you so much for all the information, and it's good to actually have an expert. Do you know what it was? People were commenting, and the trolls, they're saying, how can you comment on something that you know nothing of? And I was saying, exactly, well, I'm going to get somebody that does. And so thank you for that. And as things progress, maybe we'll hear from you again. But hopefully it gets better. I know that it probably will get worse in this week and next week for sure. We're just going to hear more and more horror stories. But thank you, and continue doing all the great work that you do.
No, thank you. Thank you for having me on the program, and I hope what I said was useful and helpful to a few people.
Okay, perfect. Thank you. See you.